Imagine you are recovering beautifully after a cosmetic procedure, and you are eager for everything to be perfect. You see your old surgical dressing, and part of you just wants to take it off to see the results. But what is the best way to handle that initial dressing? Generally, it is not recommended to remove your old surgical dressing by yourself, especially the very first one after surgery. Your surgical team will provide clear instructions on when and how your dressing should be changed or removed. This often involves a professional doing the initial removal to ensure your safety and optimal healing. The first surgical dressing is more than just a bandage. It plays a critical role in the early stages of wound healing. It is designed to protect your incision from infection, absorb any fluid, and sometimes provide gentle compression to reduce swelling. Removing it improperly or too soon can disrupt delicate new tissue, potentially pull on sutures, or introduce harmful bacteria to the surgical site, which could lead to complications. It is carefully applied by professionals to create a secure, protective environment. When the time comes for a dressing change, your surgical team will guide you through the process, or they may perform it themselves. If you are instructed on how to change it at home, remember these key steps. First, always wash your hands thoroughly with soap and water for at least 20 seconds. Make sure you have all your new, sterile supplies ready, such as fresh dressings, medical tape, and any prescribed cleaning solutions. When removing an old dressing, do so very gently. Loosen the edges carefully, pulling in the direction of your hair growth if applicable, to minimize skin irritation. Observe the wound for any unusual changes, but avoid touching the incision directly. If anything looks concerning, contact your doctor immediately before proceeding. Understanding the why behind these steps is key to a smooth recovery. The initial days following surgery are often called the golden period for healing, where proper wound care significantly reduces risks like infection or dehiscence, which is when the wound edges separate. Your surgical team might also introduce you to specific terms, like non-adherent dressing or wound exudate, which simply refer to types of bandages that do not stick to the wound or the normal fluid that may come from a healing incision. Knowing this helps you understand the expert care you are receiving. Ultimately, trusting your recovery to the experts and carefully following their instructions regarding your surgical dressing is your best path to a beautiful and healthy outcome. Open communication with your surgical team about any concerns or questions you have will empower you throughout your healing journey, helping you to achieve the results you desire while minimizing any unnecessary stress.